Okay, let's dive into this. Have you ever woken up in the middle of the night because something confusing, kind of mysterious, honestly, was happening right in your own bed? Or maybe your partner's? Tonight, we're unraveling a genuine medical mystery that takes place entirely in the dark. Welcome to this explainer on understanding nocturnal seizures. Imagine the pure panic bed partners or families feel when they see someone suddenly thrashing, kicking, or crying out in a pitch black room. Your first thought is probably, is this just a terrible nightmare? Are they sleepwalking? Or could it actually be a seizure? It's terrifying when it happens out of nowhere, and figuring out the difference between a weird sleep behavior and something much more serious, that's exactly what we're going to do today. We're putting on our medical detective hats.
Section 1. A Mystery in the Dark. Identifying the Hidden Culprit. So let's start our investigation by looking at the evidence left behind during these nighttime episodes. All signs point to a specific, hidden culprit that operates when the lights go out: an epileptic seizure. Basically, this is a sudden burst of abnormal electrical activity in the brain that temporarily disrupts normal function. Think of it like a sudden, fierce electrical storm inside the mind. And this abnormal activity doesn't just look scary to someone watching. It literally disrupts a person's consciousness, their movement, their behavior, sensation, and even their memory.
What makes nocturnal seizures so unique is when they strike, specifically during sleep, right as a person is drifting off or shortly after they wake up. But here is the most fascinating and honestly, the most challenging part of this whole mystery. A lot of patients are completely unaware they even had a seizure. They might wake up feeling just awful, bruised, exhausted, but they have zero idea why. The whole thing happened entirely outside of their conscious awareness. Section 2. What are nocturnal seizures? The electrically hyperactive sleeping brain.
Okay, so why do these electrical storms happen specifically in the dark? You might think your brain just powers down when you go to sleep, right? But the sleeping brain actually remains highly, sometimes hyperactive. Just the act of sleeping physically changes your brain's electrical activity. In fact, some forms of epilepsy become way more active during specific phases, like light sleep, what we call the N1 stage, stage N2 sleep, and those super sensitive transition periods between sleep and wakefulness. These specific electrical shifts are what significantly increase the likelihood of seizures in susceptible folks.
So what does this internal electrical storm actually look like on the outside? Well, here are the physical clues. You might see sudden body stiffening or rhythmic jerking. In cases like frontal lobe epilepsy, we see what's called sleep-related hypermotor epilepsy. The patient might suddenly sit bolt upright, kick, punch, twist, or thrash with these really repetitive movements. They might cry out, gasp for air, or, strangely, have their eyes wide open, even though they're completely unconscious. More severe signs can even include tongue biting or urinary incontinence. These episodes are brief, sure, but as you can imagine, they are incredibly dramatic.
And then comes the aftermath. Medically, we call this the post-ictal state. Once the dramatic physical thrashing stops, the patient is left dealing with intense confusion, overwhelming fatigue, massive muscle soreness from all that exertion, blinding headaches, and sometimes even trouble speaking. This recovery period can last for just a few minutes, or it can stretch into hours. But because of the memory loss tied to this state, the patient usually remembers absolutely nothing about the event itself. And this is exactly why family members or bed partners are absolutely crucial eyewitnesses in our investigation. Their accounts are pure gold.
Section 3. Seizures versus sleep disorders. Ruling out the suspects. In any good investigation, you've got to clear the innocent bystanders, right? This is the differential diagnosis phase of our medical detective story, where we meticulously rule out other sleep disorders that perfectly mimic seizures. First up in our lineup is REM sleep behavior disorder. How do we tell them apart? Well, REM sleep behavior disorder happens during REM sleep, and patients are actively acting out their dreams, so waking up and remembering a wild, vivid dream is very common. Nocturnal seizures, on the other hand, are usually brief, they look exactly the same every time, which we call stereotyped, and crucially, they are not associated with vivid dream recall. So the lack of a dream narrative helps us clear this first suspect.
Now, what's really interesting about this slide is the stark contrast between seizures and sleepwalking. Sleepwalking happens in deep N3 sleep and typically involves calm, almost purposeful wandering behavior. Contrast that with nocturnal seizures. They have a very sudden onset, feature those fast, repetitive, jerky movements we just talked about, and they end abruptly. Calm, quiet wandering versus sudden, violent thrashing. That is a massive clue for our medical detectives.
Section 4. Investigating nighttime episodes. Tools of the medical detective. Now that we know what we're looking for, what tools do doctors actually use to definitively catch this electrical culprit in the act? Well, it all starts with the medical history. Doctors rely heavily on detailed witness descriptions, noting the frequency and exact timing of these nighttime episodes. But they're also hunting for specific triggers in the patient's lifestyle. Two of the biggest culprits that lower the seizure threshold are sleep deprivation, which drastically increases brain excitability, and alcohol use, which messes with normal sleep architecture and alters brain activity. These are massive pieces of the puzzle that a good history reveals. Next up is the EEG, or electroencephalogram. This is a fundamental test that records electrical activity right at the surface of the brain. It is literally looking for abnormal electrical footprints, those epileptiform discharges and abnormal rhythms that the seizure leaves behind in the brain's circuitry. But to really, truly solve the case, we turn to the absolute gold standard: video EEG monitoring. This brilliantly combines a continuous EEG to watch the brainwaves with a video recording to watch the body at the exact same time. It allows physicians to directly correlate the physical thrashing with the electrical spikes happening in the brain at that exact millisecond. It is the ultimate, undeniable proof. And hey, if the diagnosis is still uncertain, or if a sleep disorder is strongly suspected alongside or instead of epilepsy, doctors will use polysomnography, which you probably know as a sleep study. By using an expanded EEG setup, meaning more sensors to monitor the brain, doctors can fully capture a night's rest and definitively distinguish between actual seizures and parasomnias, those other sleep behaviors we ruled out earlier.
Section 5, 5 Essential Safety Tips, the Protection Plan. We've solved the mystery of what these events are and how to detect them, but the most important part of this explainer is what we do next. How do we keep patients safe when they are at their most vulnerable, asleep in their beds? So, the crucial point is, if you take anything away from our time today, let it be these 5 vital steps to prevent nighttime injuries. Step 1, always sleep in a safe, uncluttered environment. Step 2, pad the sharp edges of any nearby furniture, like nightstands, to prevent blunt trauma during a thrashing episode. Step 3, strictly avoid elevated bunk beds. The fall risk during a seizure is just too high, it's a no-go. Step 4, ensure all family members are thoroughly educated on seizure first aid so they know exactly how to react and protect the airway. And Step 5, maintain a regular sleep schedule. Remember earlier when we said sleep deprivation is a major trigger? Consistent sleep is your best, most natural defense. Beyond those environmental safety tips, the medical treatment side is incredibly promising. Anti-seizure medications are highly effective at stabilizing that abnormal electrical activity in the sleeping brain. The secret to success here is taking these medications consistently without missing doses and, like we discussed, strictly limiting alcohol if your doctor advises it. I really want to reassure you that with an early diagnosis and these proper safety habits in place, a lot of patients achieve excellent control over their seizures and experience a vastly improved quality of life. And this brilliantly illustrates a key clinical insight. Not every unusual movement during sleep is a seizure. Likewise, not every seizure involves dramatic convulsions. It's a vital, overarching reminder that careful medical evaluation using all those diagnostic tools we discussed is absolutely always needed. You just can't guess in the dark. Which brings us to the end of our medical mystery. We've uncovered the hidden culprit, but it leaves me with a final provocative thought for you to consider tonight. Are you paying close enough attention to the resting bodies and electrically hyperactive minds in your own home? The sleeping brain is a vast, endlessly fascinating frontier. Thank you so much for joining me on this explainer. Stay curious and sleep well.